going to talk to you guys a little bit about the treatment for the grade 2 AC joint sprain for our patient. I'm going to talk to you a little bit about the basic guidelines for that, and then we can discuss how it'll be a little bit different because this individual is bound to a wheelchair. So mainly rice for the first 24 to 48 hours. You're going to keep it rested, in a wrap, in the sling, elevated as possible, and just keep that person comfortable. Rest and protective sling is going to last for 1 to 2 weeks depending on the pain and comfort level of the patient. So once that pain really subsides, you can take them out of that sling and let them start moving the shoulder around. But as you know, with athletes, it can help to sometimes keep the sling on a little longer because once they know that it's okay, they're probably going to start pushing it. Anti-inflammatory medications are going to be great right now. You're going to start working on that, and the pain part of that is going to help you as you are working through the range of motion. So 7 days after injury, gentle range of motion can be started. That's going to be passive, so you're just going to start working on that, kind of get the blood flowing in that shoulder joint again. And then at that same time, you can start doing activities of daily living. Now, that's where it's going to be a little bit different for this individual because an activity of daily living for them is moving around in their wheelchair. And since the arm has been immobilized and since that AC joint is going to be a little bit tender to new movements, pushing through with the wheelchair is going to be a little bit more challenging. So this person is going to need a slower progression, and they're probably going to still need a little bit of help moving around in that wheelchair as you're working through the first parts of rehabilitation and getting that motion back to where it needs to be again. And again, you can discontinue that sling when the pain subsides. So modalities for this are going to be ultrasound is going to be a great one, kind of work on that tissue healing, getting the blood flowing back in a place that hasn't been moving a lot. You've got ionophoresis, which is going to get muscle or pain medications, down into the muscle tissue using an electric current. You can use desensitizing grafton around the AC joint, maybe work on any swelling that's kind of still sitting there, and again, use that grafton to work on those muscles that have been stuck in the same position in that sling the entire time and get that shoulder kind of loosened up and ready to use. So as far as rehabilitation goes, you're able to start that after 2 weeks with pain as a guide. So let that pain kind of let you know when it's time to stop, slow down, put on some ice for the day. You can start working with gentle range of motion. Active range of motion is going to be a good thing to start here, and then isometrics will be good. Something I would suggest for that is putting either the patient, if you're not able to be with them, up against a wall and they push into external rotation, internal rotation, abduction, all that stuff against a wall. If you are able to be there, obviously they can use you, and just that kind of general stuff, squeezing the hand, even working those little hand muscles again, getting the biceps going, because although we're focusing on the shoulder, that whole area has been in the sling this whole time, so we want to get everything back to where it needs to be, get those little muscles shrunk so they can start squeezing the wheel of their wheelchair again, pushing themselves around. Also get that biceps tendon comfortable, get the shoulder comfortable. So that's going to be the treatment portion for this.